inflammation or inflammation and infection. So now you've got a child breathing through their nose, bypassing the filtration system to the back of the throat. Now that's getting swollen too. Now they're having trouble breathing both through their nose and through their mouth, and they're in real trouble. And we see this increasingly today. This is a good summary of what we've just been talking about. He says, you take a child, let's say, who's allergic to dairy. Nobody knows it, and they begin receiving dairy products, milk, etc., and they're allergic to it, so therefore they develop allergic signs and symptoms. Stuffiness in the nose, runny nose, they start breathing through their mouth. Now the problem really begins, because when they're breathing through their mouths, they get a lack of filtration, as we've just discussed, and cleansing of the air, allowing these airborne bacteria to settle and flourish where? On the tonsillar tissue. So you get an increase in volume of dirty air over these lymphoid tissues of the adenoids and tonsils, and as a result of that, you get greater congestion and you get overbreathing because of the difficulty of breathing. Now you're blowing off CO2 when that's actually important to maintain or retain so that you can deliver oxygen. So you have a lowering of oxygen delivery all through the body. You don't release nitric oxide, so therefore you lose that bacterial control as well as the vasodilation that goes along with it. We're learning that with breastfeeding, one of the reasons it's significant is because you have to work for it. And the tongue is really going up in the roof of the mouth and squeezing and going forward and laterally as well, and you're using your elevator muscles. And this is very, very important. When you just give a child Gerbers and they just swallow, there's a lack of development of the musculature and craniofacial complex, and it affects breathing. And soft diet then goes right along with that. So those are just some of the reasons. This is not new information. I've talked to a number of experts in nutrition, and two that I've run into, almost the first thing they said to me is, you're a dentist, right? Did you know that the first person that ever started talking about the connection between diet and illness and poor health was a dentist? And they're talking about Weston Price. This is a book that's commonly read by people that are not in dentistry, talking about physical degeneration and its connection with nutrition. What he found in his studies going to different groups and remote groups and tribes around the country, and then looking at what happened as they became more civilized, also looking at anthropologic studies, is the fact that anthropologically, historically, what we see is you look at skulls in museums going back, let's say, more than about 300 to 400 years ago, before the Industrial Revolution. You see great big rounded out arches, you see fully erupted third molars, and you see very little decay, even with severe wear, as you see in this case, where there's a lot of wear into dentin but no decay. It wasn't a conducive environment for the bad bugs, the pathogens, and there was plenty of room for all the teeth. So a note, third molar impactions and decay are a modern phenomena. And so the question would be, how come? We'll talk about that. Another really excellent researcher, anthropologist named Robert Corricini up at Southern Illinois University, who Ben knows very well, wrote a book on how anthropology informs the orthodontic diagnosis of malocclusions. This is a man who spent his lifetime studying dental malocclusion as an anthropologist. He is not a dentist. And what he found was, as he would go to remote groups that were living off the land and not involved with civilization and changes in that way, not living in close quarters, not eating a lot of sugar, etc., you saw a completely different facial profile that was one of excellence, as opposed to those that began to integrate a Western lifestyle, softer diets, go to work and feed the babies bottles, things like that.